want to introduce our next guest, is Congresswoman Nanette Barragán of California. She's a member of the House Energy and Commerce Subcommittee on Health and serves as chair of the Congressional Hispanic Caucus. Welcome, Congresswoman.
Oh, sure.
Thanks so much for joining us. Well, let me ask a question I asked the congressman. Do you think that there's any hope of a deal before Congress gets out of town on a supplemental? That's part one. And part two, and I hate two-part questions, but I'm going to do it anyway, is are you hopeful we can avoid a government shutdown? There's been some concern from congressional Democrats about the White House and negotiations on border issues.
How long do we have today?
We've got a few minutes.
Well, you know, the Hispanic Caucus and I am not happy about reports coming out of these talks.
Yep.
I am a firm believer that we should be having a vote on foreign aid.
Mm-hmm.
So Ukraine, Taiwan, Israel, that should be a vote. There should be a whole different conversation if we're going to start talking about immigration changes combined with border. Let me tell you, we completely understand that there are needs at the southern border, and those are things that Republicans and Democrats should support, including increased capacity, increasing money to make sure that you're stopping fentanyl from coming across the southern border. Those are all in the president's supplemental, which Republican senators said no to. $1 billion for ICE beds was in that supplemental that said no to. So I don't believe they really want to fix the problem because they're saying no to things that they know would help, but it's a political football, so I don't think there's a real interest in them.
So are you optimistic, or do you look at, I mean, listen, I mean, the deadline's right when you guys get back. They're right on you for the government, keeping the government open.
Yeah, I mean, the government open is a different question, and I think that's going to be a greater challenge. I think that it's going to be up to Speaker Johnson whether he's going to use Democrats to help save government again, because that's what's been happening all year long.
As we've been talking this morning, CMS has announced the first 10 drugs for price negotiations. They treat heart failure, diabetes, kidney disease, among others. What's your take on how CMS is implementing this important law?
Well, I think it's kind of early, but you know, there's some things I like that CMS does, and other things that I don't like that CMS does, and that's the great thing is. If you see something not happening right, it's a time to speak up. That's something that I did on the Alzheimer's work. And so, you know, with drug price negotiation, it's going to be a matter of, you know, just kind of following the process and doing the same thing. But my constituents, when they hear about the drug price negotiation, they're frustrated because it doesn't go into effect right away.
Right.
Right, and so every year I do this really big senior fair. I get 1,200 seniors come out. We get a really packed ballroom, and I tell them about what we did, and they feel relief, like, oh great, now I'll be able to afford, you know, my prescriptions. And then they hear, well, it's only 10, and then like, oh wait a second, what? And then they hear, well, it's not going to go into effect yet, and so then, you know, they're very frustrated. So for us, it's a matter of just making sure it's being done quickly, on time, making sure it's, you know, drugs that people are using that's going to benefit, you know, the greatest good. So I think those are the kind of factors we've been looking at. And
how much of a concern as CMS implements it, and you know, legislation gets a lot of headlines, but implementation does not. But as CMS moves forward on implementation over the next several years, how much, we've been talking about access and utilization, how much should that be a factor that's got to be monitored so there isn't rationing of care, or everyone is getting the access to the drugs they need?
Well, that's a huge issue for me and for the Hispanic Caucus. Access to care is the biggest concern we hear about, and it's the biggest thing we see. It's that everybody doesn't have equal access. So that is going to be an important thing, and one of the things we talk very frequently with Secretary Becerra. So having somebody at the table, I think, who understands some of those barriers and challenges, whether it's things like even language barriers, not understanding something because it's not in their language. I even get constituents when I have to do town halls ask me, they don't even understand Medicare. What are all the different parts? And they get confused because they get, of course, all these advertisements about enroll in this program and that program. And so I think there's just a lot of a continued outreach we have to do to educate folks, but also making sure that when you're having things like clinical trials, right, that they are in the communities where people have access to them. I represent a very working class district. It used to be the fourth poorest district in California. They just redistricting. I don't know what the new number is, but this was a concern that the people in my district realistically just couldn't get to where they had to go. So I think the same is true with implementation, making sure it's being done in a way that's going to be equitable.
You've been a leader on Alzheimer's. Where are we in the search for a cure? There's some promising treatments out there now.
Well, there's progress being made, and people have marketed it as a huge thing. And I think in the everything's relative, right? When you haven't had anything, you have something. It's a big thing. But for families like me and millions across the country, it's not happening fast enough, right? And we feel like we need something, sooner.
Right.
And that is one of the reasons why, when this all first started happening, just to remind you quickly, when FDA approved the drug way back in 2022, and then CMS said then we're going to cover it.
Right.
I was like, what do you mean? Like, this is an equity issue. Only people who can afford it are going to get it.
Right.
And I remember that at the time, we were in E&C and hearing, and one of my Republican colleagues was speaking out against this. And I'm listening, and I said, wait a second. I agree with that person. I want to speak out, too. And there was pushback from, wait, that's not a Democratic talking point. This is not a Democratic issue, a Republican issue. This is about access and equity and, against the advice of, people who say what they prefer you talk about, let me just say. I did anyhow, and that's when I'm always going over to my Republican colleagues to say, how can we work together on this? How can we partner together on this? And I can't help but notice Dr. Larry Bucshon was your prior guest, which I have a really funny story I want to share with you.
Please do.
So you never quite know how or when Democrats and Republicans are going to come together.
Right.
But years ago, my mom was in the ER, and she was ill, and she had to have emergency surgery. And after the surgery, the surgeon comes in to see my mom. And we got into talking, and long story short, he says to me, oh, do you know Larry Bucshon? And I said, oh, well, I serve on a committee with him, but I don't know him that well. And he said, he was my roommate in medical school. And I said, oh, wow, that's pretty awesome. And I said to the surgeon, Dr. Campbell, I said, I'm going to go find him, and I'm going to see how we can work together. And so when I got back to Washington, one day during votes, I'm asking all the Republicans, where's Larry Bucshon? Where's Larry? And I go find him, and I sit next to him. I introduce myself, and I said, hey, and I told him this. I said, oh, Dr. Camel. He goes, oh, yeah, he was my roommate. And I said, he was my mom's surgeon. And I said, we need to find things to work together on. And so it's really just kind of interesting how, things come together sometimes. So we go often, our staffs work together to see if there's common ground on something that we can work together on. And so that's kind of led us to work on something called the Triumphs for Moms Act that we had. But
and that's not common. I mean, it happens, but it's not common on the Energy and Commerce Committee.
Right. And it's a small world. But what are the chances that my mom's surgeons, was roommates with another member of Congress? So that was pretty neat.
Did you get any good stories about the congressman from the roommate, maybe?
No, but I do often.
Could use that.
I do often go to Larry and say, hey, I know the dirt.
Right, exactly.
But it's he's somebody we've been working on too with the Alzheimer's issues.
And speaking of legislation, how things come about, I wanted to ask you about your Medicare Dental Act of 2023. And my dad's on Medicare, and it came up a couple months ago where I was like, yeah, I don't know where dental falls on this. Tell us about the bill and it's your strategy for getting it done.
Well, I tell you about this town hall we do every year when we get the 1,200 seniors. And one of the things we hear often about is the lack of being able to go to see a dentist and the coverage. Now, when I was a kid, I grew up in a Latino household. I was the youngest of 11 kids. We always had Coca-Cola. And I didn't really understand how bad it was for you. And I had decaying teeth. I never knew why. Of course, later on now I know. And, it's kind of like my parents, I never really ever saw them go to a dentist. And just so you know, my parents were 25 years apart. So my father was 59 when I was born. You could say I was the last accident, right? And he never had any teeth. He never had teeth for my entire time that I knew him. And so for me, hearing from constituents, not having access myself, having a parent who never even had teeth, and then learning about the connection between seeing a dentist and healthcare in general, made it one of the reasons why we look for any opportunity to work with anybody who would work on it. But the idea here is, of course, that people on Medicare should be able to have dental coverage. And it's something that everybody that I talk to in my district agrees and says, why isn't this done? And why isn't this part of coverage? It's healthcare. And so we've just been pushing on this issue with Senator Cardin on the other side. And, many times, unfortunately, people say, well, the cost. It's always about the cost, right?
Right.
And this is where I think healthcare in America is broken, because we spend way more money waiting until things get so bad and then we cover it. But we don't invest in preventive care. And I think that's one of the reasons that healthcare in America is just completely broken. My mom has diabetes, and one day her A1C was really high. So she had to go to see an endocrinologist. And they gave her this little machine to put on her to monitor her sugar all the time.
Okay.
What happens as soon as her A1C fell under 8? They take it away. Oh, Medicare won't pay for this anymore because your A1C is not high enough. Like, this is ridiculous. You're gonna you're only gonna cover something when you are that sick. Yep. You're not gonna cover something to help prevent and keep somebody's diabetes under control. And this, again, is my frustration I have with our healthcare system, and why I try to partner up with anybody I can to address these. And a lot of the times, the issues I'm working on are issues that I personally deal with one of my sick parents or a family member, and then that becomes like the signature champion issue. By the way, I'm very excited that we are going to be voting on the Parkinson's bill. My father had Parkinson's, and I grew up watching him with Parkinson's, and most of my memory of him is with Parkinson's and him shaking, and us, laying in the bed together, and me holding his arms because I wanted the shaking to stop as we would, watch baseball. And so to see that there had been a compromise, because I know there was some politics behind what the final bill was going to look like, and it almost didn't get a bipartisan vote. To see that, kind of worked out and coming to the floor, and of course with our colleague Jennifer Wexton, who has been a dear colleague, and kind of watching has been really hard. But it's really our personal experiences that sometimes move us. And I have a sister now with multiple myeloma, and when I heard about Steve Scalise getting, I thought for a moment, like, maybe this is something we can work on together, right? Making sure that we're investing and doing what we can to make sure that there's progress in that field and area as well. Speaking of working together, we had an audience question from Becca Durr of Novartis. Do Democrats see areas of agreement on technical fixes to the IRA? We were talking about this earlier this morning. Just in this polarizing time, it's really, as you know, technical fixes to big legislation are common. Sometimes that doesn't mean they're easy to do. Right. What are your thoughts on that? I'm open to them, and there, frankly, are things that we hear about now that my initial reaction is like, oh, that's terrible. Like, we have to fix that. I have heard about the small molecule problem and its connection to multiple myeloma, and how what's going to happen is there's going to be more investments in infusion as opposed to pills. And as somebody who hates needles and has a really hard time with needles, for me, that's devastating. Like, oh my gosh, people are going to have to go in to get an infusion as opposed to a pill. Makes me definitely give thought to what can we do to fix this. And so I think that there are our opportunities always to try to fix something. There's good intentions behind bills, and then sometimes the intention is very different than implementation or how it ends up working out, or negative impacts in other ways. And so I think that that's something we all should always be open to, is making sure we try to fix something if it is not, if the implementation is not as intended, or if the impact is so large that we hadn't thought about it in advance.
I'm going to end on a big question as well. Both parties are not tackling Medicare reforms or Social Security reforms, but both programs are headed for insolvency at some point. Congress is so polarized now, and obviously it's not going to happen anytime soon, but as you kind of were talking about before, the longer Congress waits to fix things, the harder it is, especially from a cost perspective. Do you think that at some point in the next 2 to 4, 6 years that there's going to be, the parties are going to come together and do what they have to do to keep this program strong?
Well, everything comes down to cost and budgets, and that's what your values are. And, I think there's ways that Democrats feel we could raise dollars that Republicans don't agree with.
Right.
And many times it's people paying their fair share, and that could be something on making sure that the wealthiest are paying their fair share of taxes, which they're not. So I think that's always the concern is our values are in finding ways to pay for things that are different than our Republican colleagues. But the idea of cutting Social Security or Medicare, for me, is a non-starter. So what else can we look at? I mean, we're about to vote on the NDAA, and we find billions and billions of dollars to invest in that. And so it's again, a matter of values. And, our older Americans work hard and pay into the system, and we have a duty and a responsibility to take care of them in their older years, and it's not easy, and people are living longer, so it's certainly something that I think we need to preserve and expand, not cut.
Yep. There are many challenges ahead. I guess we'll take it 1 month at a time with Congress. Please thank the Congresswoman for joining us this morning.
Thank you.
I'll hand it back to Sarah.
Okay.
Thanks so much.
That brings us to the end of our program today. Thank you to our moderator, Bob Cusack, and to all of the amazing guests who joined us today. On behalf of the Hill and our sponsor, the Alliance for Aging Research, we would like to thank all of you who joined in person and online. If you missed any portion of today's discussion, or would you like to watch it again, it'll be available on thehill.com in its entirety shortly. Thank you for joining us today. Have a great rest of your day.